Hello friends, in the second part of the congestive heart failure, we will deal with what do you mean by normal heart, then ventricular failures, left ventricular failure, right ventricular failure, and what are the consequences of that, how it is leading to the heart failure, and what are the various treatment strategies for the congestive heart failure. So this is what the normal heart, way back toward the anatomy physiology. Four chambers, two auricles, two ventricles. This is the left side of the heart, this is the right side of the heart. So superior vena cava and inferior vena cava bring the blood to the right auricle, then into the left right ventricle, and then to the pulmonary blood vessels, to the lungs. So here we can see from this superior and inferior vena cava, it is coming to the auricle, then it is a ventricle. From ventricle, it is going to the lung, like this. For exchange, then after exchange, it is through the pulmonary vein, it is coming to the left side of the auricle. Then from left auricle, it is coming to the left ventricle. From left ventricle, it is going to the systemic circulation, like this way, and to the body needs. Again, it after utilization, like deoxygenation, it is coming to the right side. From right side to the pulmonary, pulmonary to the left side, from left side to the systemic to the right side, like this way. So it is moving continuously over here. So this is happening to the normal. Now there is something abnormality into the ventricular part, this part or this part. Majority of time left side, left ventricle. Majority of 2/3 time this is abnormality over the here, and 1/3 time that can be a majority into the right side of this ventricle, right side of this part. So there can be a thickening of the wall, there can be thinning of the wall, and this part of the uh, heart cannot function as a normal uh, pump. So this is happening in what happens into the left ventricle. This is normal heart, and this is the left ventricular hypertrophy. You can see the thickening of the wall. This thickening of the wall has led to the reduction into this volume. This volume. This volume is much greater than that of this. Or there can be thinning of this wall also. Okay, and due to this reduced muscle mass, now if there is a thinning, much amount of blood can be filled, but what happens, because there is no muscles, you cannot pump even at that time also. So there is no contractions happens, and the cardiac output ultimately will be reduced. So ultimately this cardiac output which is going here into the systemic circulation, remember well that when there is a left ventricular failure, the amount of a blood which is going to the systemic circulation is affected. Okay, so if the blood is not going to the systemic circulation, then where it will go? Ultimately it will be pushed back to the lungs. So what will happen to it? So we have already seen that almost 2/3 cases where there is a left ventricular failure, and due to that the blood cannot go to the systemic circulation, like this way. It cannot go to the systemic circulation. Therefore the cardiac, because the cardiac output is less, the heart does not work as a pump over here, and it does not give the blood to the systemic circulation. So where this blood will go? Definitely this blood will go back to the lungs, flow back to the lungs. It will be pushed back to the lungs. It will not coming here, so therefore it will be pushed back to the lungs. So what happens, what it leads to, that accumulation of this fluid into the lungs. So here in corner I have seen it, the alveoli. So there's a leakage of the fluid inside. The plasma will start leakage into the alveolar air sac. Into that air sac the fluid will start leaking. So accumulation of fluid in the lung, and which is leading to the pulmonary congestion. Now ultimately what happens, what is the function of this is to exchange the gas. So if it is a accumulation of a fluid, the exchange of gas will not take place ultimately. So leakage of the fluid inside, and it is leading to the embolism, the accumulation of fluid in that pulmonary region, which is leading to the pulmonary edema, shortening of the breath, difficulty in the breathing. This is what happened, that is blood is moving to the lungs, but blood is deficient in the systemic circulation. This is leading to the reduced oxygen carrying capacity and tiredness. The muscle over here will not get the adequate amount of blood. Ultimately one part is going to the brain also, so there can be a general lethargy. So brain is not receiving the blood, systemic circulation is not receiving blood, and this blood is pushed back to the lungs, which is leading to the leakage of the blood, leakage of the plasma inside the alveoli, and the lungs are even affected, getting affected. So this is what happens whenever there is a left ventricular hypertrophy. So these are the some mathematical calculations which are related to the hypertrophy. If there is a something happens to the filling of the blood and something happens to the ejection of a blood. Systole means contraction, and due to that what happens, and if it is a dilation, then what during that filling, this is the ejection, this is a filling. Okay, so what is the ejection fraction? Ejection fraction is the amount of a blood which is filled and how much amount is gone out. So ejection amount raised to filling amount. So this is the ratio in between. So generally, normally what happens that around 100 ml of a blood is filled inside the ventricle, and out of that around 60 ml is gone out. So that is it leads to around the 60%. So normal values of the ejection fraction of a normal heart is 50 to 70%, depending upon the rate and force of contractions. So 50 to 70% of the blood which is filled into the ventricle will be ejected out. What happens is that only due to the myocardial atrophy or myocardial thickening of the wall or thinning of the wall, the ejection fraction is reduced. The ejected amount, it has been reduced. Filling amount is again okay, normal, but ejection fraction is reduced. The amount which is going out, the cardiac output is reduced, and it is reduced up to 30%. So it is a systolic dysfunction, less than 40%. If it is less than 40%, it will be collagen. So here it is 30%. So ejection fraction is reduced and cardiac output is reduced ultimately. So this is what about the ejection of a blood. But what happens to the filling of the blood? So again, the first equation we have seen that is normally the amount which is filled and amount which is ejected out. So normal value 60 to 100, around 60%, normal value 50 to 60%. Now here you can say the ejected fraction is 30%, but the filled fraction is 50 only. So the amount which is filled due to relaxation of the heart, due to diastole of the heart, it is 50 only. And ultimately, if you see the fraction which is gone out of the field, then it is again become 60%. So it is almost all normal. We can see from the fraction, if you fraction ejected. So out of 50 ml, 30 ml is going out, means 60% of the blood which is coming inside the heart is going out. So it is a diastolic. So if the ejection fraction is more than 50%, but the ejection fraction is normal, fraction is of a ejection is normal, but the cardiac output is reduced. Here the cardiac output, it should be 60. So it should be again 60. Fraction is 60, but amount is reduced. So total amount of a blood is reduced. Okay. So cardiac output is both in both the condition, either systole or diastole. So condition is different, the amount of filled and amount going out. So these are the different, little bit confusing, but still you can rewind the video if you do not understood. See it, read it properly and understand it. Then this is about the right side ventricular. So you can see here the normal heart and abnormal heart. There is a thinning of the thickening of the walls. Thinning can also be possible over here, and therefore again the same thing happens. The only thing is that where the blood is gone and where blood is not going, that we have to see. Again, it is 1/3 of these patient will be related to this. Now this part is now affected. This part, if it is affected, so the blood is not going to the pulmonary artery. Now previously blood is not going to the systemic circulation. Now here the blood is not going to the pulmonary circulation. So due to that, what will happen? The blood will retain into the systemic circulation. It will go back to the systemic circulation. And why this happens? Why the blood is not going to the pulmonary circulation? Because there can be a left ventricular hypertrophy. There is a damage to the left ventricle which is pushing back the blood to the lungs, and from lungs it is impercated to the right side. So right side ventricular hypertrophy can be as a result of left ventricular hypertrophy. Left ventricle cannot push it in systemic circulation, therefore it accumulates in the lungs. It is accumulated in lungs, therefore right side cannot pump into the lungs. So therefore it will lead to the right side ventricular atrophy also. So left ventricular atrophy leads to the right ventricular atrophy if it is not treated properly. So this right ventricular atrophy will lead to the blood will go back into the systemic circulation instead of a pulmonary circulation. It will be going into the back into the systemic circulation. And if blood pushes back into the systemic circulation, it will lead to the abnormal fluid accumulation towards the whole body. So if this can, you can see this figure now. So there is a leg in standing position, the legs are swollen, there is a edema inside this legs. You can see here redness of this field. So this is due to the accumulation. There is a sacral and abdominal. Sacral region means here in a buttock, and abdominal region also there is a accumulation of fluid is taken. Distension of a jugular vein. Jugular vein is near the neck over here. So there is a distension, thickening of the blood. You can from outside also you can see there is a thick blood vessels. So there is a thick distension of this jugular vein is seen, and this is the pushing of the blood towards the systemic circulation, and which is leading to the systemic hypertension. This is one of the major consequence of the right ventricular hypertrophy. So left ventricular hypertrophy and right ventricular, if left ventricular hypertrophy takes place, then it will push the blood towards the lungs and there is a deficiency in the systemic circulation. If right side happens, then it will push the blood to the systemic circulation and deficiency to the there is no space actually into the pulmonary circulation, because it is a consequences of left ventricular hypertrophy. So as far as these are the consequences of it, there will be hypertension, accumulation of a fluid, leakage of the fluid inside the lungs and all these things, hypertension, etc. So how there is an imbalance in between the whole the system. So how you have to treat is that these are the treatment strategies and drugs used in the treatment of the CHF. So first of all, to treat the these hypertension and all these things, adrenergic agents we will use: beta blockers, vasodilators, arteriovasodilators, and calcium channel blockers. Diuretics will be used to remove that accumulated fluid over there. And for the correction measures, again, the drugs which are used, the drugs which are acting on renin-angiotensin pathway, they are also used. Mainly there are ACE inhibitor, angiotensin converting enzyme inhibitor, angiotensin inhibitor, and angiotensin receptor inhibitors. So these are the different type of drugs which are used in the treatment of this congestive heart failure. Now the third part, we are dealing all these three only, these three part: adrenergic, diuretics, and RAA pathway, drug affecting an RAA pathway. So we are dealing completely on this only. So third video we will proceed for the third video after this regarding the treatment strategy. Thank you very much.